So today I am joined by a friend of mine in Houston, Texas, Dr. Venu Julapalli, who is a colleague of mine from Houston Methodist Hospital. He got so mad over the mandates that he went to law school, and now he is suing the hospital. And his lawsuit is remarkable because he has managed to get to discovery, and he is suing over the mandates. But I would like you to tell your story, Venu. Welcome, and tell us sort of what happened to you during the pandemic.
Sure. Well, thanks for having me on, Mary. I know that we've been through a lot and there's way more to go, I would think. Um, what happened during the pandemic? Well, first off, I decided to go to law school before all of this happened.
Okay.
So it wasn't that I went to law school for this, but of course, what I learned in law school has certainly helped me through this process. Um, I guess we should start before the pandemic. I mean, for me, I'm a solo practitioner. I'm a solo gastroenterologist. I've been in my own practice for, 20 plus years. And so I've always been independent. I've always been an independent physician. I love it. That independence is very critical for me because, in large part, because that's what helps me take care of patients. And so for me, that independence is very critical to proper patient care. It's not that we don't collaborate with the hospitals. Of course, we do. They have resources that we don't in our clinics, but it's a collaboration. It's not a one and the same. So the trend that I was seeing over the course of a decade or so was that independence was breaking down, and I would say the pandemic really made it go on steroids. It really took it off, and so that trend was happening before the pandemic began. And then as the pandemic began, and then all of these things were being put in place as a result of the pandemic, I mean, that's when that independence really broke down. And I would say it uh, broke down like crazy over the vaccine mandates.
Yeah.
And, I guess we could start there.
Yeah. So, like you said, yeah, you were independent. And like myself, I was independent. And it gave us a different perspective than I think a lot of our colleagues. So, you had privileges at Houston Methodist Hospital.
Hmm.
Uh, and your brother also had privileges at Houston Methodist Hospital. And then the mandates came. And I just want to remind everybody that Houston Methodist was the first in the country to mandate the COVID shots. They did it 5 months before Biden. We got the notification on April 1st, 2021. So, what was your response when you got that notification?
Sure. So I had privileges at Houston Methodist Woodlands. I mean, there's like 7 or 8 branches here in Houston. And as you said, Mary, Houston Methodist was the first hospital in the country to mandate the COVID-19 vaccine. They did it on their employees first. They announced it in December of 2020, and then they ultimately instituted the mandate on their employees in March or April of 2021. Um, I think it's important for the viewers to understand that physicians are not employees of the hospitals. We have privileges at the hospital, and we have privileges to get on the medical staffs of the hospital. So every hospital has a medical staff. And the medical staff is what recommends a physician who's applying for credentials to get on the medical staff. And then ultimately, the board of directors of the hospital is what confers those privileges. So we don't go through HR. We don't go through any of the stuff that the employees of Houston Methodist or any other hospital goes through. That would be the nurses, the physical therapists, and the like. So you can think of us as independent contractors. It gets a little weedy in there, but that's the way you can look at us. So Houston Methodist then extended that vaccine mandate that they had mandated on their employees to the physicians. And as you said, that was around April 2021 when they announced that. The way they did it at Houston Methodist, I would say, was unique as opposed to other hospitals who did it later. The way Houston Methodist did it was to go through the medical staff bylaws. So they had the medical staff bylaws at each of the different branches, actually, the medical executive committees at each of the different branches adopted a motion to enforce the vaccine mandate on the medical staff. Now, vaccine mandates or vaccines in general were never tied to our privileges. I mean, we had the flu vaccine, right? And they would tell us every year, here's the flu vaccine season. Are you going to get your vaccine? And so you could take the vaccine, or you could apply for an exemption, a religious exemption or otherwise, and nobody cared. Nobody said anything. I applied for the religious exemption for the flu vaccine for 2 straight years at Methodist, and nobody cared.
Yep.
And importantly, it was never tied to privileges.
Right.
It was tied to reporting to Medicare and getting some sort of, Medicare funding or something of that nature. It was not tied to privileges. This was the first time that it became tied to privileges. And the way Houston Methodist did it is through the medical staff bylaws. So they had to amend the medical staff bylaws to give the enforcement power for the medical staff to be able to then execute on the vaccine mandate and then get rid of the physician in terms of the privileges.
So, and who is in charge of altering the bylaws?
Well, that's a great question. I mean, the physicians are supposed to be in charge of altering the bylaws. I mean, that's what the medical staff bylaws are for. So this is another important point. The medical staff is independent of the institution. Houston Methodist has its own bylaws, the hospital bylaws. The medical staff has its own bylaws. The medical staff is in charge of formulating the medical staff bylaws, amending the medical staff bylaws, and there's a whole process by which you do that. There's notice that you have to give. Any amendments have to be on written ballots. And so the medical staff is what does all that through medical staff meetings. You got to have a quorum. Now, I mean, who's writing the medical staff bylaws? Who's amending the medical staff bylaws is a great question. Is it actually the medical staff? Is it the lawyers of Houston Methodist that are doing it? I mean, that's something that we'll find out in discovery. We should, at least. But in this case, the medical staff bylaws amendments were proposed to amend the medical staff bylaws to give the medical executive committee the authority to get rid of physicians who weren't, in their minds, complying with the vaccine mandate.
And so I don't recall getting any kind of notice of the bylaws, although, I was so removed from the hospital. I don't remember getting any kind of notice that the bylaws were changed. How did that happen? Did you get a notice?
Well, no, I don't think anybody got the official notice. The official notice, it depends on the hospital, but the official notice is supposed to be, 15 days before the vote on the amendment. What I remember is that we got a notice the day before the vote. Literally, like the day before the vote is what I remember that we got. At Houston Methodist Woodlands, there was a staff meeting that night before the vote. And in that staff meeting, they just kind of casually introduced these amendments and said, hey, we're just looking to align all the hospitals together. And so we're proposing these amendments. It was done by not necessarily by even the medical staff, although the chief of the medical staff was there. This was all virtual because it was still COVID time. This was May 2021. But it was done by, an officer in the medical staff services of Houston Methodist Woodlands. And so I looked at those amendments, and I mean, those amendments had like a God clause where it said, if you don't do X, Y, and Z, including but not limited to A, B, and C, you would get your privileges terminated, suspended, and ultimately terminated. So, I mean, that amendments, as I saw it, was giving the medical staff the authority, I mean, to get rid of you for just about any reason. Mm-hmm. And so that was proposed that night. And, I couldn't sit around and do nothing. I was like, the medical staff, we on the medical staff have to look at these amendments. And so I constructed a mailing list that night of over 1,000 physicians on staff at the Methodist Woodlands. And I said, I don't know if you guys have looked at these amendments, but you better, because it's got this clause in here. And that's where it all started. I mean, it just took off from there. This was May 2021. Ultimately, I created a listserv over this. And like I said, we had over 1,000 physicians on that listserv.
Do you know how many people voted for the amendments?
Well, that's another good question. To this day, we're not sure. So once I had people pay attention to, what is going on. I mean, I get people responding back to me saying, my gosh, we didn't know that these amendments existed. I mean, you know this, Mary. Most physicians are just, they got their nose to the ground.
Mhm.
They're not necessarily that active in terms of all of this stuff about bylaws and amending bylaws. So people weren't necessarily aware of it. And then when they came to be aware of it, they got pretty concerned. I heard from people like that overnight. And then ultimately, the vote happened the following day. The vote was on a Google sheet. It wasn't even on any written ballots. It was just on like a Google sheet, not anonymous, no quorum that I'm aware of. So all of these bylaws provisions that we have in the bylaws to pass these amendments legitimately, they weren't followed. And then, like a week or so passed where nobody knew what actually happened with the vote. And so by this time I had this listserv. So we were going back and forth like, okay, what's going on? What is the vote count? And then finally, a week later, the chief of the medical staff wrote an email saying, we heard from a number of people. The vote has passed, but we're going to take out that including but not limited to clause that rub people the wrong way. Now, even that is against the medical staff bylaws. You can't just take out a clause just because you want to. You gotta put that up for a vote again, which obviously didn't happen. My calculation is because somebody else went and found out the actual vote count. I think this thing passed by 3 votes. Maybe I'm not even sure. I mean, that's what we were told ultimately.
Right.
But did it actually legitimately pass or not? I don't know.
So what did the clause allow for exemptions, or how? I know that your brother got an exemption and you didn't. So what was the justification? Was that in the bylaws?
Yeah, so the policy itself allowed for medical and religious exemptions. That was built into the Houston Methodist vaccine mandate itself. So the medical staffs were simply following the policy. Now, I applied for a religious exemption request. The same religious exemption request that I had applied for 2 straight years with the flu vaccine. I was denied. The letter that I got from Houston Methodist, it just was like a boilerplate letter saying you have not stated enough to adequately explain your issue. And I could tell it was boilerplate because I saw that other people had gotten these letters and it was the exact same letter. Mm-hmm. So then I started asking, okay, who's on the COVID-19 vaccine religious exemption panel? I think that's what they called it. What's the criteria? I got no response whatsoever. Well, let me take that back. I was told by Boom, the CEO, and the CMO, Robert Phillips. Phillips is the one who responded to me, but Boom was CC'd on that email. You need to talk to the medical staff over there at Houston Methodist, the Woodlands. They're the ones that are handling it. Then I went and talked to the chief of the medical staff there. He said, we don't make any decisions here. All that's done down at the mothership in Central. So it was just this kind of back and forth. Nobody really wanted to answer what the criteria was. There was no appeal process, by the way. I mean, all I got was a letter saying, that's it. You haven't stated the issue. If you want to take it, you can take it. Otherwise, you'll be suspended. So there was no process to appeal. There was no hearing. There was none of this due process that normally is afforded to physicians when there's an action taken against you with regard to your privileges. In fact, they built that in. They said, oh, no, this is not an adverse action. This is simply, we're just doing some ministerial kind of things. And it's okay. You're going to get rid of, you're going to have your privileges done. But this is not an adverse action. It's not going to be reported. And that was by design, because if they did say it was an adverse action, then most medical staff bylaws, if not all of them, say you got to have a process for that. You got to have a hearing. You got to have the ability to sort of cross-examine people. They didn't want to go through any of that stuff. So they just got rid of me.
Right.
And then you mentioned my brother. So my brother My brother has a similar religion as I do. My brother had a religious exemption request. Now, this came later when they mandated the booster. Uh, that's when he applied for his religious exemption request. It was initially denied, and then he resubmitted it, and then 3 weeks later they took him in.
Probably because there was growing growing fury from the staff, I bet.
Well, I mean, this is what I'm saying in terms of the lawsuit. Why did they have this kind of haphazard, irrational, inconsistent way of doing things? Well, if you look at it from the standpoint of, okay, religious exemptions, what's the criteria, then it all looks very irrational.
Mm-hmm.
But what I'm contending in the lawsuit is that the whole thing was a sham. The whole vaccine mandate, the religious exemption request, the thing was a sham. What they were doing was just taking control of the medical staff. And if you were really economically valuable in the hospital, then they kept you or they found a way to keep you.
Mm-hmm.
But if you weren't considered to be economically valuable, then they would get rid of you. My brother is way more active. My brother's an interventional cardiologist, takes call in the ER, active at Houston Methodist Woodlands. My brother was valuable enough for them to keep.
Mm-hmm.
I wasn't. So they got rid of me and they kept him. And so that process of, hey, are you part of our, are you valuable in some way? Is there a way we can keep you? And if so, how can we kind of coach and finagle this setup to where we will be able to keep you?
Exactly. I have said all along, I mean, they went after me because I was expendable. If I had been chief of cardiothoracic surgery, there is no way they would have gone after me the way they did. But I was economically meaningless to them. And so they used me to set an example. And like you said, I mean, you and your brother, same religion, but one of you is more economically valuable than the other.
And I'll add here the reason this is so important. I mean, yes, I got my privileges suspended and ultimately terminated, but it's not just about what happened to me. It's about the bigger picture of what this all means, and that's what I think is very critical to understand. When medical staffs are not independent, when you don't know if the person on the medical staff is acting in your best interest when you're in the hospital versus the interest of the hospital itself, you're in trouble. You're in trouble when you're admitted to the hospital. Medical staffs are independent and supposed to be independent for a very critical reason, especially in Texas, where we have a very strong, or supposed to have a very strong, corporate practice of medicine doctrine, which basically says, listen, all of the decisions that the doctor makes and the medical staff makes as a collection of doctors should be independent of the corporation, because you don't want that to influence your decision making when you're taking care of a patient. So what's happened, and goes back to the beginning of this conversation, this trend of the medical staffs and the hospital being considered one and the same, and control over the medical staff, installing whoever's on the medical executive committee to basically rubber stamp what the hospital is doing. This is bad stuff for the public at large. And the lawsuit that I've filed against Houston Methodist and other defendants, really the crux of it comes down to that. That's what I want the public to understand.
Well, the other point that you have made is this mandate, and this is a loophole that I found when I signed my attestation. I signed it with the intention of getting the COVID shot. And I did go to the pharmacy, or I went to a grocery store. Mm-hmm. I stood in line and I intended to get the shot, but the line was really long. I got impatient and I left. And then I decided I am not going back. Mm-hmm. So all you had to do was say that you intended to get the shot. They never asked for proof. And what was their motivation behind that? And I tell us that explanation. You've told me before that makes a lot of sense.
Well, I think it's an illustration that the whole thing is a sham, because you're absolutely right, Mary. I mean, when they when they announced this, that this was going to be enforced on the medical staff, you got an email. We got an email basically having a few choices. You could either say you got it. You already got, you got some series. At the time they had J&J, as well as the Pfizer and Moderna. Or you could say, I'm filing for medical and religious exemption. Or you could say, I am intending to take the vaccine. Now, they never followed up. They never followed up on any of these intentions. They didn't ask for verification. They didn't come back later on. So what that meant was you could be an unvaccinated physician walking around in the hospital, and they could still say they were 100% compliant, which makes no sense. If the entire intent of the policy was to stop transmission, which is the exact, I mean, that's actually what's in the policy statement, to stop transmission and infection. Well, then how are you going to do that if you have this loophole?
And they were trying to get their outpatient surgery services up and running, from what I understand, because that's right. That is the golden nugget of revenue in a hospital, is outpatient surgery services. And by, supposedly mandating everybody on staff to get the shot, they were a safe place to get surgery. Am I right?
Yes, because at the time, the outpatient surgical services, all those elective surgeries had been cut off. And so again, it's an economic thing. Follow the money. And so they were trying to figure out, well, how are we going to generate business again? And so that's how they could say, well, yeah, we're 100% compliant. Yet you had this loophole where, if the intent of your policy is you're trying to stop transmission, then how can you have this?
Did they ever share their data about, how effective their strategy was by mandating the shot on everybody on staff? Did they prevent transmission? Did they share that data?
Well, I think in hindsight, we know the answer to that question. Forget about hindsight. They knew, because one thing that we all have to remember is, I mean, at the early on stage, they were vaccinating more people than anyone else in town. Mm-hmm. And they had all that data, especially with their employees, because a lot of their employees may have been getting it straight through Houston Methodist itself, because they were also not only having people attest, but they were also giving it. So they had all this data. They had the data of, were they actually preventing transmission or not? I asked for that data on the listserv, I and a few other people. Like, okay, if you're saying the whole point of this is to stop transmission, well, okay, so is we doing that? Is Houston Methodist doing that? Nothing, not a word, because the data doesn't exist. I mean, if they knew that they were stopping transmission, they would have been plastering that on every billboard in town. Did you see any billboards in town telling us that they were stopping transmission? I think most physicians knew by mid-2021 that it wasn't stopping transmission.
Right.
Which defeats the whole point of a mandate.
Wait, did you have any brave souls on the listserv speaking up? Or, I mean, what was the reaction on the listserv of all these doctors?
Well, I'll tell you, if you go back to 2021, and you know this, Mary, there were a minority of physicians who were speaking up on the listserv. Myself, my brother included, and a few others. There were a certain group of physicians who were very vocal against us. Mm-hmm. And supportive of the mandate. And really, the first thing I said on the listserv was the purpose of this listserv was to have free and open exchange of all matters relevant to the medical staff. So I didn't care if you were for the mandate, against the mandate, for the vaccine, against the vaccine. I wanted all of us in a virtual lounge to have discussion. The same way we'd have discussions all the time in the regular lounges, right. Which, by the way, I think by design, there was an effort to not have those conversations, because that exchange is where, we learn about stuff. And so all that was actually suppressed. But we were having that on this listserv. I think we were the only ones in the country that had this collection of physicians on the ground having a discussion about something that's in our wheelhouse. Like, is this a good idea? Is this not a good idea? So you had a few physicians speaking against vaccine mandate and against vaccines in general, COVID vaccine. Then you had a few physicians completely on the opposite side. The vast majority of physicians silence.
Mm-hmm.
Didn't say a word.
Right.
Right. And that, to me, like one of the most disappointing things to this day for me is the abject silence of most physicians who internally knew and maybe even sided with us in terms of the mandate. And certainly by the booster. I mean, I would say, I don't know if you agree with me, but by the time of the booster and by the time Houston Methodist mandated the booster, that was in February, March 2022, the majority of physicians were against the booster mandate. In fact,
Right.
they weren't even taking it themselves, right?
Right.
And yet, silence. And that's the thing. If the physicians collectively had spoken their minds, had actually expressed externally, this wasn't even in public. This was, a listserv. It wasn't even going out to the public space on YouTube or something. But if they had expressed what they were thinking in their own minds and hearts, none of this, I don't think any of this would have happened. But the physicians were silent. And many of them are silent to this day.
Oh, yeah. What about administrators? Were they allowed on the listserv?
Well, I mean, I was told that people high up in the administration knew about the listserv. I was told that in no uncertain terms. So they had access. I mean, this was a mailing list of physicians because that's what I had access to. But it's not that they didn't know that these discussions were going on. They absolutely knew that these discussions were going on. And I mean, there was some chicanery that was going on even from the administration. I mean, I have very strong reason to believe that at some point early on in the listserv, they actually blocked it for physicians who had HoustonMethodist.org domains, basically physicians who were part of their physician organization. Mm-hmm. They would have on their emails HoustonMethodist.org. That was their email. For about 2 or 3 weeks or so, I don't think they were getting the emails from the listserv because I was told, I was like, hey, I'm not getting the emails. And it was a little bit of a surprise to me. And then I come to find out, oh, maybe they're blocking it. And then I expressed that on listserv, and then it got going again. Of
course.
So I mean, there was, I believe, censorship that was happening on the listserv itself from administration.
Wow. You think everybody in administration actually got the COVID shots?
Well, I don't know the answer to that question, but I have my suspicions. So we were talking about how they wanted to keep you if they found you to be valuable, right? They wanted to have a way. Well, given the notoriety that I had been, for better or for worse or by choice or not, given the notoriety that I had gotten because I had started this listserv, I got wind of things. So on one particular occasion, I had a colleague that came to me having been initially denied her religious exemption request. She said she had something to tell me. And so she sat down with me and my brother, and she said she's on staff and she's considered to be very valuable. Her boss, who also is the chief medical officer of Houston Methodist Woodlands, wanted to keep her. And she told me that she was given the opportunity by the chief medical officer of Houston Methodist Woodlands, the opportunity to fake taking the vaccine.
Who is that?
The Jason CMO? Knight. Jason Knight. Still Knight? The CMO at Houston Methodist Woodlands, now a defendant in the lawsuit, I should add, offered this colleague that he wanted to keep, according to her, the opportunity to fake taking the vaccine.
Wow.
Now, she didn't take up the offer. She did tell me that she had a follow-up question for him, which was, am I the first person that you're offering this to? To which he told me the response was, I can neither confirm nor deny that.
Wow.
Now, 3 or so weeks later, her initial religious exemption request was reversed and it was granted.
Wow. So it was initially denied. They wanted to keep her. He brought her in and said, we'll just give you a fake vaccine. She said no. And then her religious exemption was magically granted. that
That's what
right?
she told me. That's what she told me.
Has anybody else come forward?
Well, I don't have that knowledge, but when you're chief medical officer of one of the main branches of Houston Methodist, if he's offering an opportunity to fake it, I mean, the whole thing is a sham.
Right.
It makes absolutely no sense. It's wrong to give people these kinds of opportunities. And I mean, is he giving that opportunity to everybody? Obviously not. So many people lost their jobs over this. Did they get that opportunity? I don't think so.
Yeah. How many doctors lost their privileges? You know?
Hard to say. I mean, those are numbers that I'd like to know. How many doctors actually lost their privileges? How many doctors were compelled or felt under duress that they needed to do this in order to keep their privileges? That's a figure that remains to be totally understood. How many doctors filed a religious exemption request? How many doctors had their religious exemption request denied? How many doctors had them granted? What was the activity of the doctors? Were they busy? Were they not busy? The chief medical officer, Jason Knight, had expressed that those who filed religious exemption requests that were considered valuable, that he was coaching, that he was finding a way to coach them through their religious exemption requests. I didn't get any coaching. He didn't coach me. So how is he selecting who he was going to coach and who he wasn't going to coach? What was the criteria to see if you got to be coached or not? Was it how many cases you did there or how active you were? That's a total, you know this, Mary. I mean, they're not supposed to ask you, how many cases are you doing? How many patients are you seeing? That is a third rail. And there's a good reason for that, because when they ask you questions like that, that starts to skirt into that edge of, are you influencing my decision-making about what I'm going to do, who I'm going to see, how I'm going to see them? Those are medical decisions. And so these administrative types, they're not supposed to be asking you or having you fulfill any kind of quotas.
Yeah, I'm sure they track you. I'm sure they have all
They
sorts
track
of
you,
data.
but
Yeah.
they can't ask you.
Mm-hmm.
And they're usually very careful about it. But I think in this case, they weren't being so careful.
So tell us the details on the lawsuit. What exactly are you suing for?
Sure. So I filed a lawsuit against Houston Methodist and the Woodlands, the medical staff, the physician organization, which is the organization that employs physicians within that organization, not the hospital, but this organization, which then, of course, Houston Methodist influences, and Jason Knight. And what I've alleged is that they colluded with each other to boycott me, a guy that they felt was not economically valuable to the system. And they used the vaccine mandate as a ruse, as a pretext to get rid of people like me.
Mm-hmm.
And they worked around it with fake vaccine offers and other things, coaching, massaging, religious exemption requests to keep those folks that they wanted to keep. And that hurt the public. That hurt competition. That's against antitrust law here in the state of Texas. So that's the legal argument that I have made. Now, what's the bigger picture? The bigger picture is medical staffs should be independent of the hospital systems. When they're not independent, when they're colluding with each other, that is a dangerous situation for people who have the misfortune to end up in the hospital. Mm-hmm. It's dangerous. Mm-hmm. You have to know when you're being taken care of by a physician in the hospital that they're acting in your best interest. When that trust begins to break down, which it has been breaking down before COVID, and then it just took off during COVID, and with especially with all these vaccine mandates. When that trust erodes, the whole thing is over. I mean, there is no practice of medicine without that trust. And I'm sure you would agree with me. I have patient after patient who tells me, I do not trust this system anymore. It's tragic. I don't want patients to feel that way. I want them to trust the healthcare institutions. They certainly have a role. I want them to trust us. I want them to trust Houston Methodist. I want them to trust these institutions, but they can't because of ridiculous stuff like this.
Wow. Yeah. And you miraculously survived the motion to dismiss, and they tried to change the venue. Am I correct?
Yes, they tried to change the venue. They tried to change the venue where they had a favorable decision in a lawsuit that I had originally filed only against the medical staff. And so they wanted to go back up there to shift this case to, they lost. And so now this case is past that motion to dismiss. And to my knowledge, I believe I'm the first person to break through against Houston Methodist over this particular issue, to break through to discovery. So what does that mean? It means I can get evidence because I have to prove my case. I'm the plaintiff. I've made all these allegations. They are serious allegations. I have to prove it. And that's what discovery is for. So what does that mean? It means answers to questions, getting documents, depositions, and finding out information that is relevant to this issue for me to be able to prove the case.
And is there a hearing scheduled yet?
Not yet, but there will be.
Okay. Have you taken any depositions yet?
I'm about to.
I can hardly wait. Who are you deposing first?
Well, I won't get into the litigation strategy. Let's just say that a case like this has long tentacles that reach out far and wide. And so we need to be exploring down all where those tentacles lead.
And you have brought on a partner to help you. And I know you are asking the public to support you because now it's starting to get, now is when the fees start to come in and you need some financial support. I'm going to include it's a GoFundMe account, I believe. So everybody can pitch in. This is a huge deal. This is a huge
It's Gifts and Go. Sorry.
Oh, Gifts and Go. Good. I don't like GoFundMe. So Gifts and Go. Yes. But this is a big deal. This is a huge case. We have gotten to discovery. I mean, that is massive. Depositions, massive. I mean, it is very exciting. I applaud you. I mean, wow, this is just, I can't tell you how excited I am. So I hope people will follow this story, share this story. And if you can pitch in to help Venu's legal fees, that would be wonderful. But we will have you on again soon with updates. And
if I'll just speak very briefly about the financial aspects.
Oh, right. Yeah.
Cases like this are very expensive. And, let's get real. Houston Methodist is a titan. They are one of the biggest companies in Texas. They have huge influence. I can't watch a single football game or a basketball game without seeing like 5 commercials of Houston Methodist on breaks. They control media. They control communication. They're massive, and they have a huge stack of money. What is the fundraising going towards? Well, I've set it up so that it's very, very honest and transparent. The fundraising is going toward litigating the case. It goes toward the legal fees as far as the work that's put in by myself as the attorney and my co-counsel. I have an excellent co-counsel now. It goes toward the depositions, it goes toward discovery, and it goes into a trust account. So we have to be very strict in Texas in terms of how the money is used. And so whatever money is contributed goes into a trust account, stays in the trust account until the work is actually done. And that's how I've structured it. I've started a Give, Send, Go campaign. It's Give, Send, Go / Houston Methodist Misleading Medicine. And I really appreciate this opportunity because we're just getting started here. It's going to be long, tough work, but we're on the offense, and we've got the ball, and we're headed down the field.
I love it. Well, thank you so much. This is a great way to start 2026. I keep saying this is the year of retribution. And Venu, you are leading the charge in Houston. So I'm very excited. Thank you so much for coming. And we will have you on again soon.
Well, thank you, Mary. You're leading the charge too. And I'm just, you're opening up the holes, and I'm going right through them.